Okay, so today we're going to talk about symptoms and injuries. And to begin talking about this topic, here's this question, and I want you to tell me, why do people go to the emergency room? Why do you guys think people go to the emergency room? Give me some examples de por qué la gente va al emergency room. Accidents, okay. What else? Okay. Headaches. Headaches son dolores de cabezas. Injuries, very good. Yeah, you can have a heart attack and other type of attacks. Okay, stomach pain. What else? Oh yeah, pain, en general, pain. Yeah. Okay. What else? Yeah, the descompensación. That's just feeling ill. COVID, yes, COVID. Fractures. Fractures, yeah. Rupturas, strains. Infartos, yeah, heart attack or other types of attacks. Do pregnant women go to the emergency room? Or do they go to another place? Yeah, so pregnancy. Pregnancy can be another example. What else? Okay, yeah, overdose, sobredosis. Overdose. That's a good list, I think. And someone said asphyxia. Yeah, una caída sería un accident, un tipo de accidents, o un tipo de injuries. So, para que no sea tan... porque falling no sería como una razón. Pero si tiene un accident o un injury, ahí sí. Okay, very good. So yeah, that's a good list of why people go to the emergency room. Has anyone been to the emergency room because of an accident or injury, or you were feeling sick at some point in your life? Yes. Okay, Kira says yes. Carla says also says yes. Okay, stomach and headaches. Very good. Okay, yeah. Sí, o sea, lo más típico it's going for headaches or stomach pain or pain in general. And when you fracture something or you have strains, I'm pretty sure those are the more typical reasons why you go to the emergency room. Very good. Okay, so as I was saying, today we're going to look at symptoms and injuries, and we're going to look at some vocabulary. Antes de la pandemia iba harto, desde que empezó nunca más me enfermé. Okay, that's good. Eso es bueno. That's good. So we're going to look at some vocabulary that's related to symptoms and injuries. So the first word that we have is abdominal. Can someone read the sentence? Well, I mean the definition. No one? Okay, I'm gonna read this one because this one's too short. Okay, so abdominal is when it's related to the abdomen, and we all know what the abdomen is. So you might have abdominal pain, and it's because this part of your body hurts. The second one. Okay, can someone read chest, please? Can someone read the second one?
Yo.
Go ahead, Carla.
Chest, the front surface of a person's body between the neck and the abdomen.
Okay, yes, very good. So this is our chest, el pecho. Very good. You might have chest pain, si no puede respirar. People have chest pain. Can someone read the third one? Concussion.
Yo lo leo.
Okay, Sandra.
Contortion. A region of injured tissue or skin in which blood capillaries have been ruptured.
Ruptured.
Yes.
Have been ruptured. Very good. So a concussion tiene también otro nombre que es más fácil, diría yo, que se dice bruise. Y es cuando le sale un moretón a alguien. So a concussion is a bruise. Este es un sinónimo. Este es synonym. Y no lo vayan a confundir concussion con concussion, que es cuando uno se golpea en la cabeza. That's a different thing. They sound similar. Suenan similares, pero son, they're different. Concussion is a bruise. Concussion is when you hit your head really hard and you have to go to the emergency room. But you can say concussion or bruise. And the fourth one, which is an injury, and it's an instance of being injured. So this is, yeah, estar con herido. That's an injury. Okay, number 5. Can someone read number 5, please? Do I have a volunteer? No volunteer?
Yo,
Okay, Evelyn, go ahead.
respiratory, relating to or affecting respiration or the respiratory organs.
Okay, very good. Yes, respiratory is anything that's related to the lungs and the organs that help you breathe. Very good. Sprain, anyone?
Yo, profe.
Okay, Javiera, go ahead.
Sprain, wrench or twist the ligaments violently
Mhm.
so as to cause pain and swelling.
Swelling, very good. Yes, entonces cuando uno se hiere los ligamentos, that's when we call a sprain. Y se hincha. Very good. Number 7, asthma. This is similar to Spanish, the word. Any volunteers?
Sure.
Go ahead.
Asthma, a condition in which your airways narrow and swell
Mhm.
and may produce extra mucus.
Mucus. Okay, very good. Does anyone suffer from asthma here? Nope. No? Okay, that's good. ¿Nadie nunca ha tenido asma? ¿O tiene? Maybe not. No, parece que no. Okay, that's good. Está bien entonces, that's good. And I think this is the last one. Black eye. Can someone read black eye?
Yo, profe,
Okay, Antonia, go ahead.
black eye and area,
Mhm.
¿se dice? Yeah, of bruised skin around the eye.
Okay, an area of bruised skin around the eye. Very good. Entonces, esto es lo mismo que concussion o bruise, pero específicamente en el ojo. That's why I call it a black eye, because the part around your eye gets dark. And that's how we call it when you have a bruise on your eye. Okay, the last ones. The last ones. Bleeding, I'm gonna read this one because it's too short. Lose blood from the body. So bleeding es desangrarse. Lose blood from the body. Anyone who wants to read colic? Volunteers?
Yo lo leo, profe.
Okay, Denise, go ahead.
Colic is a pain, usually intestinal or urinary, that comes and goes and comes.
Okay, very good. So it's intestinal pain or urinary pain. And it usually happens on babies or little kids. I don't think it's that common in adults. Creo que los cólicos no son muy comunes en adultos, pero on babies and young children, I think it's most common. And the last one, broken wrist. Anyone who wants to read the last one, please?
Yo, profe.
Okay, Ivania, go ahead.
Breaking or crack in one or more bones of the wrist.
Of the wrist, yes, very good. It's when you break or crack la muñeca. La muñeca? Yes, la muñeca. Your wrist, as you can see right here on the picture. Very good. Anyone has broken their wrist before? Or has broken any part of their body? Never? Lo que dice un diente, oh. Lo que dice Romina, una luxación, no, eso es otra cosa. Eso es cuando uno se le sale el, o sea, ahí creo que no se rompe, ¿no? Solamente se sale el como del lugar. O sea, el joint, ¿qué sería? La unión. Una luxación. Does anyone know? ¿Sí? Sí, o sea, uno se sale y lo puede volver a poner. Eso se llama así. When you, cuando se sale el brazo o alguna parte del cuerpo, se llama joint dislocation. Sí, eso, una dislocación. Se llama joint dislocation en inglés, como se los puse en el chat. That's how it's called. El broken wrist es algo diferente, es cuando ya está roto. Cuando se rompió el hueso. No es que se haya salido solamente. Okay, very good. Okay, so today we're gonna work for most of the time in our English for Nursing books. So I want you to open that book. Si no lo tienen, está en modo. I want you to open the English for Nursing book and go to page 28. Page 28. I'm gonna give you a minute so you guys can open your books. Were you able to open it? Do you have it open? Or do you still need one more minute?
Lo estoy abriendo.
Okay, that's okay. Okay, ¿quieres ready? Y si no puede abrirlo porque está en un teléfono o algo, yo igual lo voy a estar mostrando todo el rato, así que... pero el resto de la clase vamos a estar solamente en este libro. Because it's about symptoms and injuries, y es justo lo que what we're going to look at today.
Profe, ¿me repite la página?
28, page 28. Unit 4, la unidad 4.
Gracias.
So, if you're, ya deberían estar todos ahí. Okay, very good. Okay, so let's work together on. No, let's not work together. No trabajemos juntos. Okay, so here's some of the, well, before we start working, here are some of the words that we just saw. So we have abdominal, chest, concussion, injury, respiratory, and sprain. Sprain. We just saw these words. Now, read this small paragraph right here and try to put them where they belong. Or maybe we should do it together. Hagámoslo junto. Mejor. No lo hagan solo, hagámoslo junto. So I'm going to begin reading this and you guys tell me what word is missing, okay? So, it says, why do people visit the ER? The most common reason is for an, what will go here? What do you guys think will go in that, in the first part? Any ideas? Dice, la razón más común es por una. Is it for abdominal, chest,
Confusion, profe,
contusion?
¿o no?
No, not that one. Algo más general. Yes, injury. Very good, yes. Injury. The most common reason is for an injury. Espérate, para que no se borre esto. Espérate, deme un segundito. Okay, I see. It's for an injury. Very good. Okay, it's for an injury. In most cases, a strain. Strain es cuando uno se daña los músculos. Que es diferente a sprain, porque sprain los ligamentos. Strain los músculos. Okay, now yes, concussion. Ahora sí, concussion. And what else? ¿Qué más? A concussion and or not and or
Sprain.
or a sprain. Yes, very good. Or a sprain. The second most common reason on the list is signs and symptoms of either blank and blank. So síntomas de pain. Tenemos la palabra pain al final. So we do this one, and this one. Okay, in the chat they're saying abdominal or chest pain. Okay, yes, very good. Abdominal or chest pain. Very good. Abdominal or chest pain. Okay. And the last one, people are also frequently brought into the ER with respiratory problems. Very good. With respiratory problems. Very good. Very good, guys. Okay. Borremos las rayitas azules. Okay, so now we have this picture right here. There's different people who have come to the hospital or to the ER for different reasons. So, first question says, why do you think each patient has come to the emergency room? And what health problems do they have? Your opinion. Esta es solamente de opinión. You guys have to tell me. Why do you think each person has come to the hospital? And what health problems do you think they have? ¿Y qué problema tienen? So let's start with here on the last one, the old guy. Why do you think he came to the hospital? What symptoms do you think he has? He has chest pain, okay. A heart attack or chest pain, yeah. Asthma, yeah, he could be having asthma. Okay, so I see a lot of chest pain. Okay, yeah, that could be a possibility. Very good. And this woman right here, why do you think she's at the emergency room? She has an injury. Okay, her hand is broken. You mean because of this part right here? Yeah, she could have some kind of injury in her hand. Very good. And this guy right here, he's grabbing his shoulder. Se está agarrando aquí. His shoulder. Why do you think he's at the ER? Yeah, it could be at this location. He could be having shoulder pain. Very good. Yeah, very good. And the little girl right here. Why do you think she's at the ER? What does she have on her hands? Okay, yeah, very good. Asthma. Some of you are saying fever, a colic, asthma. As you can look at her hands, look at what she has. Okay, a lot of you are saying asthma. Very good. Or yeah, she could have COVID. Yeah. That could be a possibility too. And this guy right here, what do you think happened to him? Okay, yeah, he has a black eye. Salió de la prueba de inglés. Yeah, that could also be possible. What do you guys think happened to him? ¿Qué creen que le pasó? Did he get in a fight? Was he in an accident? He fell. Okay, yeah, he could have fallen. Yeah, very good. Yeah, maybe he got robbed. Quizás lo asaltaron. Maybe he got robbed. Or he was in a fight. Very good. And the last one, the little baby. Colic. Yeah, Melanie and Denise says colic. Okay. Also, Carla says colic. Yeah, because físicamente parece que no tuviera nada mal. So maybe he's having like interior pain. Very good. Okay, and what order do you think the nurse should see the patients? ¿En qué orden deberían de entrar? O sea, ¿en qué orden no? ¿En qué orden deberían de entrar? Pero ¿en qué orden debería atenderlos? Should the nurse help them? Who should go first? Okay, the old man first. So let's put, oops. So this one first. Who goes second? Who comes after? Who comes second? The little kids? CNA? Okay, well, let's put second. And second. And third? Who should come third? Letter E. Okay, so we'll put for right here. Okay, very good. And fourth, B. Fourth, B. And lastly, we have the guy with the shoulder pain, and he will go, oops, fifth. Okay, so you guys said first the old guy, second the two kids, fourth the guy with the, third the lady with the hand problem, fourth the black eye guy, and lastly the guy with the shoulder pain. Very good. Okay, now we're gonna listen to the 6 patients. We're gonna listen to them describing their problems, and you're gonna label the pictures you're gonna label them up here. You're gonna label the pictures AF in the order you hear them. Okay, entonces las van a listen to the 6 patients describing their problems. Label the pictures AF in order you hear them. Ya, entonces le van a poner ustedes los números in the order that you hear them, acá arriba. This is our guess. Esto es lo que nosotros estamos, o sea, es como nuestra opinión. Lo que nosotros estamos adivinando. Now you're going to listen the correct order now. And you label it up here. Okay? And then we're going to compare from the audio with what we put down here. Vamos a comparar lo que pusimos con lo del audio. Okay, let's listen. Where is it? It's here. ¿Por qué no baja? Okay, there we go. It's not working.
Recording
Okay.
30.
Ready? ¿Se escucha? Can you hear it?
Sí,
Sí,
profe.
Yes? Okay. Okay, we're gonna listen y acuérdense de numerar a quién dicen primero. Y después vamos a comparar con lo que pusimos con lo que dice en el audio.
Podría
let-
poner. No, no dije nada.
Okay. Let's begin.
1.
Aisha was playing outside this afternoon and she started having difficulty breathing. She was coughing a lot and she said her chest felt tight. She took her blue inhaler, didn't you, Aisha? But as it didn't seem to get any better, I brought her in. I've never seen her asthma as bad as this.
2.
Yeah, well, I was just coming up the main street on my bike when this little kid ran out into the road. I wasn't going very fast, but I had to brake hard and I came off my bike. I've got lots of cuts and bruises on my right arm, but it's my eye that's the worst. It's so badly bruised I can't open it. Can I get it checked by the doctor?
3.
Yes, I'm a sous chef at Bessie's place. Do you know it? Great Caribbean food. You must go. Anyway, I was working in the kitchens this morning and I cut myself really badly with a chopping knife. It didn't hurt very much at the time, but it sure does now. It often bleeds a lot when I cut myself, but
Doctor.
3.
yes, I'm a sous chef at Bessie's place. Do you know it? Great Caribbean food. You must go. Anyway, I was working in the kitchens this morning and I cut myself really badly with a chopping knife. It didn't hurt very much at the time, but it sure does now. It often bleeds a lot when I cut myself, but then it stops usually. I just can't get the bleeding to stop this time. The knife wasn't very clean though, and I was worried about infection.
4.
I fell off my ladder when I was painting. My shoulder is very swollen and painful, and my wrist doesn't look right. I can't move my fingers. That means I've broken something, doesn't it? I banged my head really hard when I fell, and I still feel dizzy and nauseous.
5.
It's my little girl, Jasmine. She had another bad night last night and she's cried nearly all day. I think she's got colic. She seems to have really bad stomach pains. She keeps arching her back and crying. Twice I gave her milk, but she was sick almost immediately, both times.
6.
I was getting out of the bath when the chest pain started. I felt a sharp stabbing pain in my chest, and suddenly it was difficult to breathe. I was very breathless, and I also started feeling very dizzy. I almost fell down, but I called my wife to come and help me.
Unit 4. Recording 30.
Okay, so let's go back to the book. Let me share the screen. And yeah, I think it's really different, right? Okay, so who was first? Sandra says C. Okay, let's put
It's
espérense,
17
déjame escribir el
hours.
número. So this one was first in the audio. Ah, come on. Espérense que estoy. Ya, es que no. First, this one. Vamos a cambiarle el color so it's different. No, no se ve. This one. Okay, ahí sí se ve. Okay, so this one was first. What was second? Oh, come on. Espérense, chicos, que estoy teniendo un problema aquí con esto. Okay, so we said the baby was first, the one with the asthma. Ahora déjenme abrir el chat para ver qué me están diciendo. Yes. So you're saying B? B is the second one? The guy with the black eye? Yes? Okay. So this one was second. Third? Who came third? E. So third. Fourth? So the guy with the shoulder problem. Fifth? Okay, the girl with the collar. Fifth. And lastly, on 6, the man with the chest pain. 6. Very good. Okay, so this is our order in the audio. We have this one first, second, third, fourth, fifth, and 6th. Okay, now, so here we have some symptoms or injuries that we also saw in the vocabulary. And we're going to listen to the audio one more time. And now you're going to have to tell me what symptom or injury each person has. So esta es la lista de los symptoms and injuries related to this. And you have to tell me which one goes with which person. Okay? So pay attention to the audio and we will order them. Any questions? No questions?
Profe, ¿puede haber algún síntoma que sobre?
Sí, hay que sobran.
Yeah.
Yes, there are some that are not, that are left. Hay algunos que sobran solamente, o sea, necesitamos 6 nomás, de los como 10 que hay. O 9, no sé. Okay, let me play the audio again. Si es que carga en algún momento, we will listen to it.
Recording
There we go.
30. 1.
Okay, so pay attention to their symptoms or injuries. Y póngala con, put it on the space there above each person's head. Póngala en el espacio arriba de la cabeza de las personas.
Aisha was playing outside this afternoon and she started having difficulty breathing. She was coughing a lot and she said her chest felt tight. She took her blue inhaler, didn't you, Aisha? But as it didn't seem to get any better, I brought her in. I've never seen her asthma as bad as this.
2.
Yeah, well, I was just coming up the main street on my bike when this little kid ran out into the road. I wasn't going very fast, but I had to brake hard and I came off my bike. I've got lots of cuts and bruises on my right arm, but it's my eye that's the worst. It's so badly bruised I can't open it. Can I get it checked by the doctor?
3.
Yes, I'm a sous chef at Bessie's place. Do you know it? Great Caribbean food. You must go. Anyway, I was working in the kitchens this morning and I cut myself really badly with a chopping knife. It didn't hurt very much at the time, but it sure does now. It often bleeds a lot when I cut myself, but then it stops usually. I just can't get the bleeding to stop this time. The knife wasn't very clean though, and I was worried about infection.
4.
I fell off my ladder when I was painting. My shoulder is very swollen and painful, and my wrist doesn't look right. I can't move my fingers. That means I've broken something, doesn't it? I banged my head really hard when I fell, and I still feel dizzy and nauseous.
5.
It's my little girl, Jasmine. She had another bad night last night and she's cried nearly all day. I think she's got colic. She seems to have really bad stomach pains. She keeps arching her back and crying. Twice I gave her milk, but she was sick almost immediately, both times.
6.
I was getting out of the bath when the chest pain started. I felt a sharp stabbing pain in my chest, and suddenly it was difficult to breathe. I was very breathless, and I also started feeling very dizzy. I almost fell down, but I called my wife to come and help me.
Okay, were you able to get them? Yes? Okay, that's good. Was everyone able to get them? ¿Pudieron encontrar los síntomas or injuries? Yes? What about the rest? Porque ahora solamente veo 3 personas who have said yes. Los demás. Were you able to get it? Yes, okay. See? Okay. Okay. Let's go back to the book. Entonces. Okay, there we go. Okay, so let's start with the first one that talks. What did that girl, that little girl have? What was her problem? Out of all of these ones right here. De todas estas que están acá. ¿Qué problema tenía? What problem did the little girl have? No, la primera. La primera de en orden que hablan. This one right here. Okay, yes, she had difficulty breathing, which was because she had asthma. Very good. Asthma. Okay, so we've done asthma. The second, ¿cuál era el segundo? The second one. This guy right here. Okay, he had a black eye. And how did he get the black eye? ¿Cómo lo obtuvo? How did he get the black eye? What was he doing? Do you remember? Yeah, yeah, that's exactly what happened. Thank you, Kiara. That's exactly what happened. The third one right here. What is her problem? Bleeding, yes. Haciendo sushi. No sé si la comida caribeña sea el sushi metido ahí. I don't think it's that type of food. Yeah, I think it's both. Creo que son las dos. Infection. Because she said that she was bleeding. Decía que estaba sangrando y que tenía miedo que quizás se haya infectado porque el cuchillo no estaba limpio. So let's put bleeding and infection for that one. Very good. And the fourth one, which one? Okay, the fourth one, this guy right here. What happened to him? Okay, yes, he fell. He fell when he was painting. And what happened? What he has a broken wrist. Very good. And where did he fall from? ¿De dónde se cayó? Where did he fall from? No, 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 no. Wrist no es codo. Wrist es la muñeca. No sé por qué se está agarrando el codo, pero it was about his wrist. ¿Y de dónde se cayó? Where did he fell from? Were you able to hear that part? Okay, Sandra doesn't know. Does anyone know? Okay, a second floor. That's a good guess. Any other idea? Any other ideas or guesses? ¿Alguna otra idea de dónde se puede haber caído? Del techo, escalera, yeah, from a roof, a ladder. He fell off a ladder. A ladder, así. Oops. Esas son las escaleras. Las escaleras como de construcción, no las escaleras que van adentro de, o sea, lo que uno tiene dentro de su casa. Porque son stairs. Stairs. Lo que va dentro de la casa son stairs. Las ladders, las escaleras de construcción son ladders. Very good. Fifth, what does that little baby have? Yes, a colic. Very good. She has a colic. And the last one, what did he have? Yes, a heart problem. Un problema al corazón. He had a heart problem. Okay, very good. Very good. Let's continue. Okay, so here we have the same dialogue from the same dialogue from the audio, el mismo diálogo del lo que escuchamos recién, but now we have to complete it with these words right here. So let's do it all together. Or do you want, ¿quieren escuchar el audio una vez más para completar esto? Estos son estar mareado. Bleed es sangrar, breathe, respirar, bruise, los moretones, cough, toser, dizzy, estar mareado, infect, infection, infección, pain, dolor, sickness, enfermo y swell, cuando se hincha algo. Okay, yeah. So she is, let's try to do it together. So Aisha is coughing a lot. So if she's coughing and a lot and having difficulty, what is she having difficulty with? Si está tosiendo. Breathe. Okay, so cough. Okay, and breathe. And she's having a lot of difficulty breathing. Sí, hay que cambiar los verbos para que estén bien puestos en la oración, para que tenga sentido. So Aisha is coughing a lot and having difficulty breathing. Very good. So Sandip has in his chest and feels okay, he has pain. Espérame que no puedo. Okay, there we go. Has pain in his chest and feels dizzy. Yes. Yes. He feels dizzy. Se siente mareado. Very good. So, sacamos, bueno, son dos dizzy. En otro también parece que va a haber dizzy. And we have pain. Very good. Okay, the seer is heavily from a bad cut and is worried about bleeding. Very good. She's bleeding heavily from a bad cut. She's worried about an infection. Very good. Infection. Okay. Jasmine has a bad stomach. Stomach what? What goes here? Stomach pain. Very good. So, a Jasmine le duele mucho el estómago. She's having stomach pain. Twice I gave her milk, but she was where was she? ¿Qué nos falta acá? She was sickness. No, not swelling. Swelling, no. Yeah, it is sickness. Sí es sickness. That's correct. But she, no, hay que cambiarla a sick. But she was sick almost immediately. Entonces le dio leche, pero al tiro se enfermó. She was sick almost immediately. Very good. Number 5 says Winston's shoulder and wrist are very. Sí, ahora sí. Swollen. They're very swollen and painful. Pero está bien escrito. Este es el pasado. This is the past. Es un verbo irregular. Yeah. They're swollen and painful. He bent his head hard and still feels. What is he feeling? Dizzy. Yes, very good. He's feeling dizzy. Okay, and then we have Jason fell off his bike and has cuts and what else does he have? Cuts and what? No queda una sola. Bruises on his right arm. Very good. Very good. Any questions about this? El audio? Anything? Okay, ¿qué te confundió, Sandra? Ok, cuando viene y otra en pasado. Hay una sola que está en pasado, que es swollen. La otra están todo en presente. You're still confused? His wrists are very swollen and painful. He bent his head hard and still feels dizzy and nauseous. But don't worry, no te preocupes porque la prueba no va a haber presente y pasado, va a ser todo en pasado. So you shouldn't worry about that. Pero en esta la mayoría estaba en presente. Okay, so here we have so here we have a table where you have to nouns are synonyms for more. We have the form in nouns. Tenemos el sujeto, que sería blood. Now we need the verb, and here we have the adjective. Let's do this. Hagamos esto, pero or maybe we practice this part right here. No, vamos a saltarnos esta parte porque quizá no nos alcance el tiempo para hacer esto. Okay, this is the last activity that we're gonna do today. So here we have past simple versus past continuous. This is what we have been looking at. Esto es lo que hemos estado viendo. And I want you to do this 8 sentences with the correct form, con el tiempo verbal correcto. So read the sentences, and I'm going to put you in breakout rooms para que lo hagan juntos. And then we're going to check together, okay? So there's, ¿cuánto hay? 13. So there we go. Okay, go to your breakout rooms, work on that activity, and then we're gonna check all together, okay? And if you have any questions, you can call me at any time. Javiera, Fernando, and Carla, join your break rooms, please. Are you there, Fernando? Ok, sí, ahora sí, ya. Cuando... Ay, me distraje, pensé. Ok, cuando es past continuous es porque la acción tuvo una duración en el pasado. Entonces, mi papá, o sea, mi hijo estaba jugando con su papá fútbol. No es algo que como que dura un segundo. Puede haber durado una hora, media hora. Entonces, ahí es was playing. Sería past continuous. El verbo playing. Pero he fell over, uno se cayó y se cae al tiro. No dura más de un segundo. Entonces ahí es past simple past. Y cuando uno dice pulled a muscle, se dañó el músculo, eso también pasa al tiro. Entonces en eso se tienen que fijar. Cuando si es algo que pasó al tiro o algo que tuvo una pequeña duración en el pasado. ¿Cuál es tu pero, Sandra? Nada? Ok. Okay, so number 2. Can someone do number 2? Sandra, can you do number 2, please?
Bueno, pero no sé si esté bien.
Okay.
My wife was
Coughing.
all
Lo escribí
night.
mal. Wait. Espera. Ya, siga nomás.
I phoned
Ajá.
the helpline.
Ujú.
And they told me to.
Told.
No.
¿Cómo lo pusieron?
Pone de.
Ok, es told, es un verbo regular. Ya. They told me to make an appointment with her GP, que es el General Physician, el doctor general. Ok, very good, sí. So my wife was coughing all night. Ahí te está diciendo toda la noche. Entonces una acción que duró por un buen tiempo. I phoned the medical helpline. Llamé por teléfono. La acción de llamar dura poco. O sea, es llamar y ponerse eso, es cortito. Y me dijeron, they told me to make an appointment with her GP. Y en que se lo digan tampoco es algo que dure mucho. Okay, very good. Number 3. Anyone who wants to try it.
Yo, profe.
Who say yo?
Kira was running a high temperature when the ambulance service Bring her in.
Brought. Verbo regular. Brought her in. Okay, so Kira was running a high temperature. Ella tenía tenía la temperatura alta. When the ambulance services brought her in. Brought es el pasado de bring. Bring no es con ed. Very good. Number 4. Anyone? ¿Nadie?
Yo, profe.
Ok,
Pero
Vania.
está buena.
Ok, no importa.
My headaches didn't stop.
Ujú.
Immediately, the tables I took
Ujú.
wasn't strong enough. No.
Wasn't strong enough. The tablets I took. No, wasn't. No.
¿Por qué?
Porque tablets es nuestro sujeto. Y está en plural. So, which one is it? No, wasn't. Weren't, sí. No se refiere a yo, a I.
No, pero the tablets son como it, ¿o no?
Sí, pero es más, está en plural. No es tablet, es tablets.
Ok.
That's why. Sí, por eso. So the tablets I took weren't strong enough. My headaches. Ok, creo que su grupo le había dicho didn't stop, pero ahora que me doy cuenta es weren't stopping immediately, porque es una acción que no se acabó inmediatamente.
Sabía, siempre lo
Sí.
supe.
I'm sorry for the group that I told them it was didn't stop. Okay, number 5. Anyone?
Yo, profe.
Go ahead.
The painting presented for ER at 11 p.m. He suffering.
Was suffering?
Sí.
Okay, was suffering. Yeah. Was suffering from serious vomiting. Very good. Ya, y una más, porque ya son las 5:50 and you have a test. Someone can do this one? Really quickly.
Creo que es. Can you tell me what you were doing when your asthma attack started?
Sí, very good. What you were doing when your asthma attacks started. Very good. Muy bien. ¿Es still confusing? ¿Está un poquito, se están confundiendo un poco de cómo diferenciar las dos?
Un poco, profe. Yo tengo una duda.
¿Cuál es su duda?
Que en ninguna de las oraciones se ocupaba el did.
No.
Pero si nos ponen ese ejercicio, tampoco, así, en ninguna posibilidad de colocar did.
En alguno de esos, o sea, en la número 6 era el único donde podía ir el did, pero era en pasado continuo. Era were doing, sí. Sí, porque ¿qué estabas haciendo cuando empezó tu ataque de asma? Entonces es como preguntando qué acción, o sea, que la acción era una acción continua, ¿no? Algo que duraba un poco. Por eso. Pero a ver si la próxima clase empezamos con una práctica de eso, de diferenciar los dos. Igual en la prueba no va a ser tan, yo creo que estos están difíciles, pero la prueba va a ser un poquito más fácil. Y eso, y nos veríamos el lunes para ver viruses and diseases y hablar sobre la presentación. y ver qué pasa con esto de la tercera pausa. Si es que va a haber cambio o no. ¿Ok?
Ya,
Any
profe,
questions? ¿Alguna pregunta?
¿cuándo va a ser la prueba? No sabe tampoco.
No, eso se los había dicho, el 7 de julio. Están en
Ah,
modo.
ya.
Están en modo. Y después les voy a mandar un mensaje por intranet.
Gracias, profe.
Ya. Un Kahoot. Sí, quizá hagamos un Kahoot en algún momento. Antes de la prueba. Okay, guys. I'll see you on Monday. Bye bye. Have a
Chao,
nice
profe.
weekend. Bye.
Chao, profe.
Bye bye.